Greetings, Health Scholars, and welcome back to the Health Scholars channel. If this is your first time tuning in, welcome. My name is Dr. Orobosa, and on this channel, I show current and aspiring healthcare professionals how to one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. So make sure to subscribe to the channel and turn on your post notifications. I promise you don't want to miss out. Now, today's conversation comes by popular request. Today, I'm going to be reviewing different universities that offer a doctoral degree in the field of healthcare administration. Many of our subscribers would like to get my recommendations of universities. Today's video is going to cover the doctoral side. It is a part of a series that I am going to be recording over the next couple of weeks. So this is why you need to turn on your post notifications. And before I get into the conversation, two things. The first thing I want to say, and I have to put this out there, is that I do not work or endorse any of the schools that are shared in this video. And so I encourage you, after watching this video, for you to do your own research and find a university program that works best for you. Should you be interested in getting a doctorate in the field of healthcare administration, and then apply at your own risk, but use this video as just a kind of guide that really can help you know how to get started. And the second thing is, before I jump into the conversation for today, here's a few words from our sponsor. Do note that today's episode is sponsored by my course, which is titled From Healthcare Graduate to Hired. I'm so proud of this course, and I know that this is the course that you need if you are an active job seeker wanting to acquire a job in the healthcare space, particularly a non-clinical healthcare job. In this course, I walk you through my 5-step strategy on how to go from active job seeker to hired, as well as I talk about things that people are not necessarily sharing with you on how to acquire a job in a digital era. Because right now we are in a digital era, and many people, when you're looking for jobs, you're looking for these healthcare jobs online. So how do you navigate that process so that it is successful in helping you getting hired? Also in the course, you get a chance to work with me and the other students in the course. I review your resume and other job hunting documents. We work together on creating your personalized job hunting plan, because once again, the ultimate goal is to get hired. So definitely check out the course. You can sign up by accessing the link in the description box, and I look forward to seeing you on the other side. All right, so we are back from the commercial break. And as I stated, today's conversation is all about reviewing 5 universities that offer a doctorate in the field of healthcare administration. And so the 5 universities that I'm going to talk about are the Medical University of South Carolina, the University of Alabama, the University of North Carolina, the University of Pennsylvania, and the University of Minnesota. So without further ado, let's jump into the conversation. So the first university is the University of Minnesota. They do offer a PhD in health services research, policy, and administration. This type of degree is a research degree. And so if you're not sure, but there are 2 types of doctorates that you can get in the field of healthcare management, administration, and some of the other non-clinical healthcare programs. So the first type of doctorate degree you can get is a research doctorate, or the second is a professional doctorate. And if you're not sure what's the differences between the two, then I highly encourage you to go check out one of my very first videos on this channel, which is titled Becoming a Doctor of Healthcare Administration. I'll probably link it here on the top of the screen or in the description box. But in that video, I provided you a detailed explanation between the differences between a PhD degree and a professional doctorate. So definitely check that out after you watch this video. And so the University of Minnesota, they offer a research doctorate in health services research, policy, and administration. Now, I was really surprised, and not in a bad way, but I was really surprised that among 100 universities, their healthcare administration, policy, and services department ranks number 2 as a program of choice. And so the US News and World Report said that their program qualified to be number 2. And so that is really amazing. And if you are interested in doing a doctorate in the field of healthcare administration, then you may feel like this may be a right fit for you. It is an on-site program. Okay, so it's not online. If you do attend their university, you would have to attend classes on campus. So just a little bit more about the University of Minnesota's Health Services Research Policy and Administration program. It is there to really help engage you in multidisciplinary examination of the social, political, and economic forces that affect the organization, financing, and delivery of healthcare services. And so, with this program, they're going to train you on how you can develop a strong career in which you're going to apply your research skills to influence policy and have an impact on the overall development and forward movement of healthcare systems. And so they stated that the graduates from this program, they find the work meaningful and challenging at times, but do find job opportunities in governmental agencies, health insurance providers, or becoming consultants or working for consultancy firms. So the potential of you getting hired for a healthcare leadership type of role or research type of role, or being promoted up if you're currently a healthcare worker, is quite high should you now acquire a research doctorate from the University of Minnesota. Now, what are some of their admissions requirements? Because I think this is very important for an individual who is interested in acquiring a doctorate degree. Do note that doctoral programs are something that you really have to take your time to research and apply to strategically, unlike undergraduate programs where you just apply to several and you're just waiting for which one is going to grant you admissions. For the doctoral side, you have to be really strategic. A lot of these doctoral applications require you to get recommendation letters, to write essays, to do informational interviews. And so it's very important that you apply to, I would say, the maximum doctoral programs that you should apply to at a time is anywhere from 2 to 3. Wait and see if they will accept you. If not, then you can proceed to move on. But because of the time and effort that you have to put into preparing these applications, trying to do 10 may not be feasible. And so for the University of Minnesota, some of their admissions requirements include they only accept students for the fall semester. So typically their program starts around December. And so you probably need to submit all of your application by the end of spring, early summer. They anticipate that it will take you roughly about 4 to 5 years to complete this program. But the good news is that this program is not requiring a GRE at the moment. Now, for a person like me, I'm going to be honest with you. One of the ways I was choosing my doctoral program, which I really didn't do as much research as I'm advising you to do. That's why I'm telling you to do research, because if I did, I probably wouldn't have went to the university that I did attend to get my doctorate. But one of the reasons why I selected the university that I did go to at the time is because they didn't require for you to have a GRE or a GMAT. Now, I know since the pandemic, many universities kind of relaxed or removed the requirement for the GRE. And so when I checked and I did put these talking points together, maybe about 3 weeks ago, they stated that you don't need a GRE at the moment. So that's amazing news. Another thing that they require is that you have at least a 3.43 GPA from your master's program. And so for those of you who are currently doing a master's program, but very much interested in getting your doctorate, make sure that you are doing everything that you potentially possibly could do to have at least a 3.4 GPA should you be interested in attending the University of Minnesota for their doctorate of healthcare administration program. Now, another requirement that I saw that they expect of you as an applicant is that your application will be reviewed by a doctoral committee. And so that's another slight difference between your undergraduate and even potentially your graduate admissions. At the master's level, at the doctoral level, they do screen candidates. They may call you in for an interview because they really want to make sure that you are equipped with the potential to be able to successfully navigate their program, because the doctoral program is not always easy. At many parts of that program, you may encounter challenges, and they want to know that you are equipped to overcome those challenges. Because, as I stated in a few videos, many universities, they want their students, when they go out and graduate, to be successful, and that success helps them market to other students. So they just really want to make sure that you are the right candidate. Now, in order to gain admissions into this program, this is something that you must know. In order to apply to the University of Minnesota, they require all applicants students for their doctoral program to have the prerequisite of economics. Now, when I did some further investigation, it doesn't look like they will offer you that course. And so before you apply, when they screen your transcript, if they don't see that you've taken an economic course, they will deny you admissions for the most part. So just keep that in mind for those of you at the master's level, or if you are interested in doing a doctorate, but you don't have economics as a prerequisite, that you may want to go and do an economics course, or you may want to find another university, because it's a high possibility that the University of Minnesota, they will reject your application. So some additional information that you need to know about their program is that they run the program on 2 terms per year. So they do like a fall and spring semesters. Some schools do trimesters. Most traditional schools do just 2 semesters per year. So keep that in mind. And that just contributes to the time that they stated that you may potentially take in completing this program. Many people who do research doctorates, it's spent at least 5 to 7 years in their program. So if you're looking for a quick doctorate, then the research doctorate may not be the best option. Professional doctorates are a little less in time, but it really depends, because as I've been sharing in so many other videos, the doctoral process is not linear in nature, meaning that if you're going to get this course and then the next phase, you're going to progress that way. Especially when you get to the dissertation phase, you have to go through different types of reviews and evaluations. And then should the committee reject your submission at that time, you have to go back to the drawing board, and that all takes time. To collect your research is another component of the doctorate program that takes time. In my case, it took me, I would say, 6 months to collect all of the data that I needed in order to move forward in writing my manuscript. And in that data collection phase, I collected data. I was interviewing different employees at the site in which I was basing my research on, and I had to clean that data, screen that data. I had to now run it through some statistical softwares and create graphs for that, and all of that takes time. So if you are looking for a quick kind of doctorate degree, unfortunately in the health administration field, there's no quick one. I know that there is a doctor of nursing practice. Their program there is a little shorter because of all of the industry experience that they require them to have. So for many of your DNPs, they've been working in a role like a nurse practitioner, or they've been a registrar RN and been working in that role for years. And so their doctorate program is usually about 1 to 2 years. That's one of the few doctorates that I see that you can do in less than 3 years. Others will require you to commit at least 3 to 8, 10 years of your life doing this program. So keep that in mind. Another thing that you should know is that they do have specialties that you can specialize under that PhD umbrella. So you can focus your research on either health policy analysis or health decision science. And so that's always good. In my own case, when I did my doctorate, I had a professional doctorate, but I specialized in healthcare leadership. And my research was geared around the leadership gaps that we see in aging and long-term care facilities. So just keep that in mind. All of this should be thought about before you even decide that you are going to apply to the university. You really want to keep your research at the forefront, or some ideas that you may potentially have of what you want to research at the forefront, and then look at the universities and their lecturers and making sure that their research backgrounds or their professional backgrounds aligns with the type of research that you want to conduct at the doctoral level. That is really important. Now, let's get to the money. Let's talk about how much it costs to attend the University of Minnesota as a doctoral student. So from what I found, it is roughly about $9,300 per semester. It can be higher depending on whether you're going as a full-time student or a part-time student. And that's something else that you should take in consideration. Are you able to do your doctoral program full-time, or are you going to do it in a part-time basis? Many people tend to do their doctoral program on a part-time basis because they're either working other jobs or trying to balance that like family work life. And so they'll take at least a part-time route of doing their doctoral program in the first couple of years. And then towards the end, they may decide that they're going to fully work on it or they may stay part-time. But depending on your frequency of attending, that also dictates how much the cost of that program will be for you. But good news is that they do offer funding and they have scholarships and grants and even graduate assistantships, which you become like a teaching assistant or a TA. TGA, which is a teaching graduate assistant. So that teaching maybe two classes while you're doing your doctoral research. And depending on the school, which I'm not sure what the University of Minnesota do, but if you're being a TA, they may potentially cover all of your cost for your doctoral program or part of the cost. Then they have dissertation grants because it takes some money to do and write a dissertation, whether you're doing a research doctorate or a professional doctorate. You do need to have some extra money to get your document edited by a professional, to get the statistical software to, collect data. And so there's some other like expenses that go into this program once you get to the dissertation writing phase. So all of these things you need to keep in mind, but it's amazing to see that the University of Minnesota offers funding to its students. Okay, so the next program I want to talk about is the University of Pennsylvania, Wharton. And so many of you may know Wharton. It is one of the prestigious programs that you see in the US, and they offer a PhD in healthcare management and economics. And so this is once again a research doctorate. And based on 100 universities, the US News and World Report ranked their specific program as number 3 on the list. So this is amazing news. And just to give you some overview of what this program is all about, the Wharton PhD program in healthcare management and economics, it also provides that interdisciplinary healthcare services research approach. And it allows you as a doctoral student to explore the private and public sector sides of the healthcare industry. And so through the combination of intense training in the healthcare systems, as well as health services research, you will be able to use your degree to help healthcare industries move forward. And so that's just a little program overview that they provided. Now, what are some of the admissions requirements for this particular program? So they also have a fall semester start. They also anticipate that in order to complete the PhD, it may take you anywhere to 4 to 5 years. It is a guesstimate. So this is why they say anticipation. It could take you longer, all right, depending on your experience in your program. But for this particular program, you must have a master's degree in either business administration, public health, or a master's in healthcare or social sciences. So they do require that. So if you have a master's degree from another industry, then Wharton most likely would not accept you into their program. And this is important to note. For doctoral students, many universities expect you to already have some field and work experience under your belt, or you've had a master's training in the field of healthcare administration, because the doctoral program doesn't necessarily come to teach you about the industry. Rather, doctoral programs show you how to conduct research that you can contribute to the existing body of literature of articles that talks about healthcare problems, solutions, and policies, etc. So keep that in mind. So Wharton requires you to have one of those masters, and they require you to complete either the GMAT or GRE. So this is one of the universities that on their website, I see that they have a requirement. I'm not sure if they waived it during COVID time, but now that we are adjusting to this like new normal, they're still requiring for you to have a GMAT or GRE. So if you want to go to Wharton University, make sure you meet these requirements in order to ensure that you have a fair chance to being accepted at that university. And so their application process is done online, and they expect you to submit it the year before you actually start the semester. So if you are wanting to start your doctoral program at Wharton, you would have to apply this year in order to get accepted for next year's cohort. So keep that in mind. Now, some additional information that you need to know is that with the Wharton program, they request that all applicants have at least a 3.0 GPA at the undergraduate level, so your bachelor's degree. So this is why it's important to give your best and exude academic excellence, because they look at all of that. Also, they are requesting for you to submit 3 letters of recommendations, and in their program, before they accept you, they want you to go through an interview process. And so that interview process, it is dynamic, it's multifaceted. I don't know like 100% what their interview process looks like, but from just my experience in serving on doctoral committees, I do know that they do have various professionals. They will have lecturers, the admissions committee reviewing your application to make sure, once again, you are a good fit for their program. Now, let's get to the money for how much Wharton's PhD program in healthcare management and economics costs. So all students at this program are offered financial aid, scholarships, and fellowships. So this is amazing news. Okay, because doctoral programs are expensive. It can cost you the equivalent of a house payment or more. You really want to make sure that if you can get scholarships or get fully funded for your program, that's amazing. If I had to do it all over again, that is something that I would have definitely went for, because I had the academic capabilities to do so, was to apply for scholarships and fellowships, or even go to a university that offered teaching assistant positions, because I already wind up in academia anyway. And so that would have been helpful, but at least I know that I wouldn't have had that debt or had to pay out of my pocket to acquire this doctoral level of education. So the fact that they offer all the students who get accepted into their program. So that's the key word. You have to get accepted first. So once they accept you into the program, they do offer you financial aid, scholarships, and fellowships to cover the cost for that program. And then they also offer teaching assistance positions as well. So that's amazing news. Now, the next program I want to talk about is the University of North Carolina. They offer a research degree. So their doctorate is a PhD in health policy and management, and they ranked number 4 from the US News and World Report among other universities that offer PhDs in healthcare administration, management, etc. Now, just a little overview about their program. And so the University of North Carolina PhD in healthcare policy and management combines rigorous training as well as understanding of research methodologies, and they allow you to use that knowledge to prepare you for an academic foundation or a research foundation post-graduation. So they're really preparing you to either work in the universities post-graduation or to become a professional researcher, which is great news. Now, their admissions requirement includes that first, you would have to, before you even submit an application, do a consultation with their director of graduate admissions before applying. This is why I tell you, you can't just be like, okay, all of these schools I want to go to, and then you're going to apply to all, because each of them have their own requirements and their own intricacies that can take time and financial resources. Okay. So keep that in mind. But you would have to have a consultation with the director of graduate admissions. Then they also have a fall semester start for those who are accepted into their program. So the program usually starts around the fall time, which is September. Some says December. They anticipate that you'll complete their PhD in roughly about 4 to 5 years, but it's an anticipation. It's not a definitive thing. They do require you to have a master's degree, but they don't care where you really got your master's degree or what specialty you got your master's degree in, but they do prefer you to have industry work experience in the field of healthcare management, administration, health services, economics. So just keep that in mind. And their program, you also have to go on campus to attend. Now, some additional information that you should know is that you must have a minimum of a 3.0 GPA at the undergraduate level. They also ask that you submit 3 letters of recommendations and that you conduct interviews. So initially, you're going to consult with the director of admissions, and then you may be called back in for other interviews with some of their faculty, etc., to make sure that you are right candidate for the program. Now, when it comes to cost, there are different fees based on your residency. So there wasn't like an accurate amount that they offered there. So depending on whether you live in the state of Pennsylvania or you live out of state, or if you're an international student, the cost for your attendance to that program will vary. So it is imperative that you ask as many questions as you need in order to make sure that you are making the right decision. And many of these programs, they do offer some type of info session, or when you're consulting with their director of graduate admissions, they do walk you through the program based on your situation and your scenario. And so if you live out of state, of course, that program is going to be way higher than if you live in state. So that's something you may take in consideration as well. Okay, so the next program that I want to review is the Medical University of South Carolina, and they offer a Doctor of Healthcare Administration. So this is a professional doctorate, and their program ranked number 19 among universities that offered some type of doctorate in healthcare administration, management, and public health. And just a little bit about their program. So the Doctor of Healthcare Administration, as I stated, it is a professional doctorate, but at MUSC, they uniquely designed that program to help fill the gap in healthcare administration education, which it allows their students to be able to explore cultural, humanistic, and professional backgrounds in changing the healthcare dynamic in the healthcare field in general. And so they stated that their graduates who do complete their program have the possibilities to enter higher education. So when people tell you, oh, you can work at an academic institution with a professional doctorate, here is a university that's telling you that with their professional doctorate, they're preparing you to work in academia. So just keep that in mind. And this is why I share this information, because I want you to make a informed decision about what university is best for you should you want to acquire a doctorate in this field. And so they prepare you for higher education faculty positions, leadership roles in healthcare advocacy, as well as the highest levels of healthcare administration. And that was one of the reasons why I also pursued a professional doctorate, is because I like the versatility that I know how to conduct research, but also if I want to go back in the field and work on the leadership side, or work in the clinics, or work in the hospitals, or be a consultant, I can. And that's some of the flexibility that a professional doctorate can offer you, because you get the best of both worlds training. You learn how to conduct research, but you also look at real world problems or create solutions for the overall administration of formalized medicine in the healthcare system in its entirety. So this is a great, great program. And I actually had a conversation with their director, and she's really, really nice. And I encourage you, if this is something that you are interested in doing, that you check out their university. They're, like I said, they're not paying me. This is not a paid sponsorship, and I'm not endorsing them, but because of the kind of loophole that I fell in with my own doctoral experience at one point in time, I thought I was going to transfer universities, and their university came up. And so I had a very detailed conversation with their director. She was really nice. She was really kind. And she gave me great advice on how I should navigate the situation that I was going through at the time. Now, their admissions requirements include that they recommend that you have healthcare experience. Okay, so having some of that work experience under your belt is what they prefer when you're being admitted to their program. You also have to have a bachelor's and master's degree. The admissions interview is given to those who are selected. So you don't initially have to interview until you submit your application. And if should they decide that they want you to give you enrollment into their program, they'll conduct an interview first. Now, in their application, you would have to write essays, you would have to submit your CV and official transcripts. And in this program, they don't require you to have a GRE or GMAT, and they also accept international students. So some additional information that you should know is that they have a fall start as well. And so you need to submit your admissions application by July 31st, 2023. And the delivery format is hybrid. So some of your didactic courses will be done on campus, but they also have some online version as they have an online option as well. And anticipate that it'll take you about 2 to 3 years to complete their program. So based on my research, it could cost you $6,958 or more per semester, depending on the program, depending on your residency status. And so the fees can be higher for you. But their program offers scholarships. And so if you're interested in exploring a DHA program with the Medical University of South Carolina, I was able to locate that they do offer a virtual info sessions, and the next one is scheduled for Wednesday, June 14th at 6 p.m. Eastern Standard Time. So I highly encourage you to check it out if this school is one of the schools of your choice. Like I said, I have spoken to their director, and based on our conversation, she really took her time. She was easily accessible, and she gave me the best advice, not necessarily leaning me to make a decision that may not be best for the track that I was on at the time. And so I think that speaks highly of a professional who didn't know me, but took the time to really help me troubleshoot a challenge that I was going through at the moment. So I recommend them. Now, the next university is the University of Alabama. They do offer a PhD in administration health services. So the way they kind of phrased it, it looks a little different than what we know, but it's still a health services administration degree. This is a research doctorate, and their program ranked number 55 out of 100 schools that were reviewed by the U.S. News and World Report. So just to give you some program insight, so their program was founded in 1978. So like I said, the field of healthcare administration is not new, but it's gaining popularity because this program has been around since 1978. But the goal is to help their students improve the healthcare administration practices and policy through the conduction of research. And it really prepares students to graduate and be able to work in very diverse settings. So whether they want to take an academic route or to even conduct research, that they say the program can prepare you for. Now, their delivery format is on campus. And so if you would like to attend the University of Alabama, you would have to go to classes on their campus. Now, their admissions requirements include that they have a fall start. So you need to apply before the fall starts. And then your application will be reviewed by their admissions and policy committee. Their application fee starts at $50, and you must submit an updated CV. So there's a difference between a resume and a CV. If you didn't know, so you need to submit a CV. You also need to submit a personal statement and have an admissions interview, but they do accept international students. And if you're coming from a country where English is not your first language, then you would have to go through some type of English proficiency exam just to make sure that you are able to understand the language that is being spoken to you when you're enrolled in this program. And also that may mean that if you're transcripts are written in another language, that you would have to get those transcripts converted over into English. And there are professional services that you can patronize to help you with that. Now, some additional information that you need to know about the University of Alabama's PhD in Administration Health Services is that they offer students the opportunity to attend this program full-time or on a part-time basis, but they prefer you to go full-time. If you want to do part-time, they have to approve you for that. You do need to complete a doctoral candidacy exam. So this exam, for those of you who don't know, some universities offer it, and you have to pass that exam before you can move into your dissertation writing stage. And from my experience and just working with doctoral students, I know that this is the part where oftentimes doctoral students give up. They give up because they have a hard time passing the candidacy exam. So I encourage you to get outside mentorship if you are one of those students who are having challenges while you're in this program, because you can do it. If I can do it, you can do it. You just may need some guidance on how to navigate the hurdles that you're encountering. But I do notice that a lot of people can start a doctoral program, but only a few actually graduate with the degree. Now, they state that the completion of their program ranges from anywhere from 3 to 6 years. And like I said, that's give and take based on your experience, the reviewers, your mentors, or a supervisor who's helping you with your research. Now, program fees. It costs about $468 or more per credit hour. And oftentimes, each class is roughly about 3 credit hours. So keep that in mind. Okay. And they do offer, though, scholarships and graduate student funding. And that funding can happen, as I stated, in scholarships, fellowships, or teaching assistant positions. All right. So those are all the universities that I have to talk about in today's conversation. Once again, I want to thank you all for tuning in. Make sure to like, subscribe, and share. And if you have questions, feel free to drop them in the comment section. But until next time, bye for now.